Hi, good morning. My name is Cathleen, as Angela said, and I'm the Policy and Project Manager in the All-Ireland Institute of Hospice and Palliative Care. I'm just going to talk to you briefly today about the first report on our phase 1 of our Let's Talk About Care survey. I'm just going to look briefly at the rationale and methodology and some key messages which arose from the data. And I'm also going to pull out some of the stories themselves and outline some of the next steps we have for phase 2 of the survey, which is currently ongoing. So the Let's Talk About survey was developed by the Institute in order to develop the first of the 7 strategic outcomes. And that is that palliative care provision and developments are informed by user, carer and community voices. Users, carers and communities have been given a role in all stages of the Let's Talk About survey. Voices for Care, the Institute's user carer panel, and social care professionals were involved in the design and development of the survey tool and in the development of the engagement plan. They were also involved in the interpretation of the results. Given the wealth of the quantitative information, we're also at an advanced stage in developing a thematic analysis, which is being completed by a Voices for Care member as well. As we continue through phase 2 of the survey, we're currently undergoing our push for engagement and until the end of May this year. And a similar process will be undertaken which will involve users and carers in the interpretation of results and in the dissemination of the survey. So based then, the methodology which is being used in the survey is based on methods and software developed by Cognitive Age using the SenseMaker survey tool. And this is similar to the survey tool used in the 10,000 Voices campaign undertaken by the Public Health Agency here in Northern Ireland. 2 stakeholder workshops were also held with the Voices for Care members and health and social care professionals to decide the questions and labels or signifiers and to also assist with the interpretation of data and the identification of key themes. A total of 367 people responded in phase 1 of the survey. The majority of respondents were carers or former carers. 56% of the respondents were former carers. 31% were currently caring for, and 13% were those living with a life-limiting condition. Of the 367 surveys completed in phase 1, there were responses from all counties in Ireland, bar Monaghan. A third of the people who responded were between 50 and 69, and 50% were between 70 and 89. The respondents were 55% female to 44% male, and 70% of the people responded that they were living in their own or their family's home at the time of the experience. Although this figure needs to be treated more cautiously, as people who would have been in hospital would have signified that they were living in their own home and not outside of their own home. So I've just pulled out the top headline findings from this, and the most significant finding was that for 63%, the biggest practical worry was planning for the future. And this came out of the 8 prompt questions which were asked in the survey, where people signified their experience by plotting them on a triangle and plotted this where it was best fitted within their own individual experience. So where planning for the future came out, overall most people tagged this one where the choices were between planning for the future, finance or cost of living. This highlights the need to minimise the additional stress and anxiety caused by these issues for individuals who have healthcare concerns to deal with, and it appears to be an unmet need. It's also really not a surprise that planning for the future came out as such an issue for people, as this is currently an issue in both the north and south. The story that I've selected is one that was put into the survey, and I thought that this illustrated the issue which is experienced by healthcare professionals and by patients, and highlights particularly the challenge of when advanced care planning has not been considered at an early stage. So 50% of the respondents felt that issues had been talked about clearly and sensitively. When looking at the correlations between the data, there's a positive relationship between clear or sensitive communication with feeling in control, the timeliness of information given, and having emotional and psychological needs met. The percentage of experiences in the avoided completely or used jargon show that there's still more focus on communication required. I selected this particular story as an example to illustrate the impact of good communication, both for the patient and their wife in this example, and also to acknowledge how many healthcare professionals are engaging effectively and sensitively with their patients. It also highlights the value of empathy and understanding to an individual, which can clearly not be underestimated at a time when people are most in need of support. 30% of people felt supported by the care that was being provided in the survey, but that meant that 70% felt frustrated or helpless, or a combination of both. The emotional state of helplessness or frustration could generally be anticipated as probable for 2 out of every 3 people receiving palliative care services. This is a challenge for professionals to respond to accordingly in a way that alleviates negative feelings and builds up a sense of support. The factors that help people feel supported, based on stories in the top corner, included being listened to, being given time, being informed, included, and being shown compassion. The story that I've selected as an example here also highlights the impact on an individual when gaps can occur in the coordination of services and the subsequent improvement which can be achieved with the introduction of a palliative care approach. The remaining headline findings in phase 1 of the survey are that 38% of people said that information was provided timely and appropriately, and 33% that they received too little too late in their experience. In relation to how in control a person was, 26% were able to make the choices that they wanted, and 34% felt that the control was in someone else's hands. 49% said that emotional and psychological needs were least well met, and 39% would have liked better coordination of care and treatment. And finally, 44% reported that family or close friends were involved or respected. There were a number of correlations identified in the data, and the main positive correlation, the correlations could potentially provide a framework for the development. The main positive correlation was that when people feel supported, there is a positive relationship between their family and close friends being involved and respected, their ability to make choices, receiving timely and appropriate information, and receiving clear and sensitive communication. The first negative correlation was where people feel helpless. There is a negative relationship, that is, they are less likely to have been talked to clearly and sensitively, to have been given timely and appropriate information, to have been able to make the choices that they wanted, and to have family or close friends involved and respected. The second negative correlation was where people felt frustrated. There was a negative relationship found, that was they were less likely to have been talked to clearly and sensitively, and to have close friends involved and respected. Arising from the data, key priorities were identified which informed the development of 7 key recommendations which are aimed at a wide range of audiences, including policymakers, statutory, voluntary and private agencies involved in the delivery of palliative care. They reflect the need to develop practice models which better coordinate care and treatment and reflect the emotional and psychological needs of the individual, their families, and carers, and support their needs to plan for the future. The need to build the capacity of professionals, along with providing appropriate supports to realise this in terms of communication and biopsychosocial competences, and the need to promote awareness of issues related to palliative care among health professionals and the general public. So we're currently undertaking our major push to gather stories for the second phase of the Let's Talk About campaign. A direct email campaign is underway, as is some significant PR activity. We have radio ads running both north and south, and there's also a digital campaign with Google AdWords and Facebook ads being pushed out. We'd like to hear from people who are living with a serious medical condition from which they are unlikely to be cured. And if you know, or if you have an experience yourself or know of someone who cares for someone with a life-limiting condition, we'd appreciate if you could encourage them to participate. So the next steps then for following the completion of phase 2 of the data collection will be to finalise the thematic analysis and make a more detailed cancer and non-cancer comparison of the responses, which has already been completed for phase 1. And the final report then should be developed and finalised by autumn 2015. So just to remind you then that the Let's Talk About survey remains open until the end of May. So if you or anyone you know has had a high impact experience of palliative care, good or bad, we would like to hear from you. Thank you.